Yeah, over at Joseph Avenue Thursday.
Hi, everybody. How are you? We're going to hang out for a few minutes
Okay, yeah, I'm back to my
before we
case
start at
until
11:30 for
Thursday.
science.
All right, I'll see you then.
There's so many
Okay,
things
bye.
going on right now in the world. I hope you're being tuned in. Um, you can look at newspapers till you kick them out. Democrat and Chronicle. If you want to see national and world news, Washington Post, New York Times, LA Times. There's a lot to be tuned in about right now. On our local front, as you know, we have the transportation issue with our schools. Some schools are still trying to work out what they want to do with kids in terms of wearing masks. In schools where they are in other states where they did not mandate masks in schools, some of those schools, many of those schools have had to shut down because of COVID outbreaks amongst children. And what's terrible about that is that children under 12 have no vaccine at this time. I'm going to say it again. I know you're sick of hearing it. You are their first line and only line of protection. So for as a parent or guardian to be vaccinated, you're not just protecting yourself, you're protecting those who have the least protection of all. The ERs are being filled up in the pediatric units and the ICU units with small children, children under 12. Almost 90% of our ERs are filled with people who are unvaccinated. Many who are in ICU, they're in with breathing tubes, they're put in a medically induced coma. You don't want that. You don't want that. You don't want that. Yes, you can get COVID if you've been vaccinated, but it is not going to be to the same degree of seriousness. It's not going to kill you. This is what we're talking about. I know personally of a young person did not want the vaccine who just spent 10 days in the ICU. She is still there. She's having breathing problems. It's not cute. And now she, wishes she had gotten the shot. The fear of the shot doesn't make sense in terms of us when we explore evidence and we look for evidence and evaluate it if it's credible or relevant. There is credible and relevant evidence that the vaccine does give you protection against this virus, which has mutated again. So we now have the mu, mu in a Greek letter. We went from delta to mu. They're thinking this one is more possibly, what's the word I'm looking for? Resistant to the medication, which makes it serious. So we have mutations because we're not protected. The more we're protected, the more we can put down all of these variants because the disease is running wild. The virus is running wild. It just looks for hosts, places to plant itself and to replicate, for its genes to make new genes and replicate. So the more that we remain unvaccinated, the more variants we will see, the worse variants we will see. So that's all. I'm going to go on to our lesson. We are in science class. I have to talk about things that have to do with science, right? So now we're going to continue on in our conversation about the human body, the reproductive system, and now we're going to talk about diseases of the reproductive system. We're going to start with the male reproductive system, and most of you, or some of you, may recognize this picture. It is of the actor Chadwick Boseman, who passed away earlier this year at the age of 43 from prostate cancer. We generally think of prostate cancer as being an old man's disease. It is possible that he carried the gene for particularly virulent, tough type of cancer. He was diagnosed at age 37, which is very unusual, but becoming more prevalent. And then he passed away this year at the age of 43. So he had prostate cancer, cancer of the prostate gland. And he went through many treatments. But what I want to talk about also, before we go on to that, Black and brown people have significantly higher levels of cancer diagnosis than whites for breast, cervical, colon, and prostate. Part of the reason is access to treatment. So I have given you a link to the Medicaid cancer treatment program in New York State where you can have free diagnosis and also treatment. And if we scroll all the way down to the bottom here where it says enrollment, you click on the link and you can have screening. And you can have free screening. There's also a phone number here. There is a Medicaid helpline number, and then you can also email any questions that you have. So it's not about being afraid. It's about prevention and early detection and treatment. So that should not be anything that would keep you from getting good diagnosis and treatment. And if you feel something is wrong, then you've got to speak up. This is your body, your health and well-being. So let's go on to the lesson now. And it is about disorders of the male reproductive system. So this is about the male reproductive system. And this picture here was actually what is the word? It's like when people carry crystals now. If someone had an ailment of the male reproductive system, they would carry these carvings with them. Whatever, as a matter of fact, in ancient Greece, whatever body part was afflicted, they would carry a small carving of that body part with them, thinking that the gods, as an offering to the gods, right? So this is a picture, a marble penis and scrotum from ancient Rome during the period of about 200 BC to 400 CE. And so this is old, right? Let's see if we can we? Oh dear. Can we make this bigger? A little bit, not a lot bigger. And so these offerings were made of marble. And what the scholars think today is that it wasn't so much as for ailments, or diseases, but for impotence, which I guess is considered a disease, a dysfunction, a erectile dysfunction, because as you know, that's a premium placed on. Let me go on. So what is ED, erectile dysfunction? It's a sexual dysfunction characterized by the regular and repeated inability of a sexually mature male to obtain or maintain an erection. It is a very common disorder that affects about 40% of males, at least occasionally. And what are some of the causes? Well, the penis normally stiffens and becomes erect when the columns of the spongy tissue within the shaft of the penis, the corpora cavernosa and the corpus spongiosum. So if you look, here's your spongy tissue here, becoming engorged with blood. And so anything that hampers the normal blood flow to the penis may therefore interfere with its potential to fill with blood and become erect. And that normal nervous control of sexual arousal may fail and lead to problems obtaining or maintaining an erection. Just a little aside is that health insurance companies will always pay for medication for this, but will not pay for contraception. Talk about a male-dominated society, right? And so the little blue pill, always covered. The birth control pill, no ma'am. Specific causes of ED include physiological and psychological causes. The physiological causes may include the use of certain drugs as antidepressants, aging, kidney failure, diseases such as diabetes or MS, tobacco smoking, and treatment for other disorders such as prostate cancer. Psychological causes are less common but may include stress, performance anxiety, or mental disorders. And the risk of ED may also be greater in men with obesity, cardiovascular disease, poor dietary habits, and poor physical health overall. Also, having an untreated hernia in the groin may lead to ED. And so, treatments would, stop smoking, lose weight, get in better health. However, the first line is now the use of oral prescription drugs known by the names of Viagra and Cialis. They increase the blood flow to the penis, and they were originally for people who have problems with circulation, okay, because we're still talking about blood flow. Other treatments can be creams, injections, a pump. More invasive approaches may be surgical implants. And also, the newest treatment may be from a venomous spider, the Brazilian wandering spider. What may offer a new treatment, and it's known to cause erection. It's a prolonged erection, however, that may damage the reproductive organs and may lead to infertility, priapism, if it happens for too long. So researchers are investigating one of the components of the venom taken in small doses to treat ED. Epididymitis, the epididymis is one of the paired organs where the sperm mature and are stored. So epididymitis is inflammation. The suffix itis refers to inflammation, appendicitis, right? Epididymitis, itis, inflammation. Okay, so discomfort or pain and swelling in the scrotum, the sac that contains the testes and the epididymis are typical symptoms, and it's relatively common, particularly in young men. So in the U.S. alone, more than 500,000 cases are diagnosed annually in men between the ages of 18 to 35, and it may be acute, short term, or chronic, where it may last for years or even lifelong. So when you have an acute condition, it's something that comes up spontaneously and is generally in short term duration. But a chronic condition is something you will have for the long term, such as diabetes, arthritis, those hang around. So acute epididymitis has a rapid onset, most often caused by a bacterial infection. So bacteria backs up through the urinary and reproductive structures. In sexually active males, it may be caused by sexually transmitted bacteria. But besides pain and swelling, common symptoms are redness, warmth, and a fever, and perhaps a discharge. Chronic epididymitis may last for more than 3 months or years in some men. It may occur with or without a bacterial infection. Sometimes it's associated with lower back pain, which occurs after an activity that puts too much stress over the lower back, such as heavy lifting or a long time driving a vehicle and just being, sitting in that one position for a long time. So how do we treat it? If there's a bacterial infection, we'll use antibiotics. And for chronic, we maybe we'll use an antibiotic treatment in order to kill bacteria, or anti-inflammatory drugs such as Motrin, what are all of those over the counter, to reduce inflammation of the tissues, and painkillers can have severe pain along with that. So cold compresses to reduce swelling. But treatment is important because major complications can occur otherwise. Untreated Epididymitis may lead to an abscess or infection, which can spread to other organs, permanent damage, and also infertility. So now let's take a look at male reproductive cancers. Why does this picture have a blue mustache? That is a symbol of Movember. It's an international campaign to raise awareness of prostate cancer and as well as money to raise money for further research. Prostate cancer is a concern within the Black and Brown community, particularly the Black community where there is a higher incidence of prostate cancer, higher death rate, and also diagnosed later. As I mentioned earlier, part of it is getting access to diagnosis and treatment, but in New York State, it is free. Diagnostic tests as well as treatment if you do not have insurance. For the Latino community, prostate cancer is a little bit lower, though other cancers are more prevalent. So what is the prostate? Let's take a look. It is a gland located in right here in the male pelvis area. The urethra passes through the prostate after it leaves the bladder and before it reaches the penis. And so the function is to secrete zinc, which is a nutrient, and other substances into semen during ejaculation. In the United States, prostate cancer is the most common cancer in men and the second leading cause of cancer death after skin cancer in men. About 80% of American men will have cancerous cells in the prostate gland by the age of 80, and prostate cancer occurs at higher rates in rich nations. Could that be related to diet? Like the US, but the rates are increasing everywhere. What could that be? So, prostate cancer occurs when the glandular cells of the prostate mutate into cancer cells. Eventually, the tumor, if undetected, may invade nearby structures such as the seminal vesicles. The tumor cells may also metastasize, spread out, and travel into the bloodstream or in the lymphatic system, where now it's going to go throughout the body. And that's what's dangerous. Prostate cancer most commonly metastasizes to the bones, to the lymph nodes, to the rectum, or the urinary tract organs. So, how do we know about this thing? Well, in the beginning, there might not be any symptoms at all. And when symptoms do occur, they mainly involve urination because the urethra passes through the prostate gland. And the symptoms may involve frequent urination, difficulty starting and maintaining a steady stream of urine, blood in the urine, and painful urination. Prostate cancer may also cause problems with sexual function, such as difficulty achieving erection or painful ejaculation. What are some risk factors? Some can be changed and some cannot, but a diet high in meat, a sedentary lifestyle or one where a person is not physically active, obesity, and high blood pressure. Risk factors that cannot be changed are older age, family history, and African ancestry. Family history is an important risk factor, so genes are clearly involved. If you have a family history of breast cancer or liver cancer or prostate cancer, you may want to be concerned whether you're male or female. They share genetic characteristics. Diagnosing prostate cancer, the most accurate test is a tissue biopsy where they take a tiny piece of the prostate gland by surgery and look at it microscopically. And then this is only done after less invasive tests have found evidence that the patient may have prostate cancer, but the diagnosis is done only after biopsy and a routine exam. So what are we talking about now? Physicals, getting physicals. So the doctor may find a lump, followed by a blood test that detects an elevated level of a PSA, which is a protein secreted by the prostate, and high normals of this PSA or prostate-specific antigen, it may indicate cancer, but not always. Sometimes they will use an ultrasound exam or an MRI to get an image of the prostate itself. Okay, and then finally, how do we treat this? Most men are diagnosed at 70. So think about Chadwick at 37. All right. So we're looking at a possible genetic link for him, right? Prostate cancer grows very slowly, so that elderly patients may require no treatment. They're just going to be watched over a few years to be sure that the cancer is not growing and causing an immediate threat. And this is used for 50% of patients that are expected to die from other causes before their prostate causes symptoms. In younger patients or those with more aggressively growing tumors, this may involve surgery, chemotherapy, and radiation therapy, where they place radioactive seeds in the area, which will kill cancer cells. And all of those can have significant side effects such as ED, erectile dysfunction, urinary incompetence, awful, but better than cancer. Patients should learn the risks and benefits with the different treatments and discuss them with their healthcare provider. We also have testicular cancer, which is in the testicles, often a lump or swelling in one or two of the testes. The lump may or may not be painful, but that's something to follow up with in your doctor. And that is more common in younger males between the ages of 20 and 39. And it's about 4 times greater in European men than those of African ancestry. Cause, we do not know. Diagnosis, again, the lump, followed by further tests. And how is this treated? It has the highest cure rate, one of the highest cure rates, so surgery, radiation, and or chemo. First, we're going to have surgery to remove the affected testes. And the survival rate is almost 100%. So that's pretty good. So these are films about how to perform a self-exam, just like with the breast self-exam. Men, you should be doing this all the time. At least do it once a month. Make a plan, put it in your calendar for a certain day of the month. And remember, a lump in one, a change, pain, tenderness, blood in the semen, blood in the urine, build up a fluid. So that's what we have for this. There is your summary. I'm not going to go through that right now because we're going to go back over this again on Thursday, and then the review. So just digest all this, take it in, and we'll talk more about it on Thursday. And that's all. You all take care.